Well, thank you for having me to the round table. I'm really happy to be here today. I think this is an exciting opportunity to make a difference in early care and education. And today I'm going to focus my comments on the Child and Adult Care Food Program. I think we have a very significant opportunity to reduce obesity in early care and education settings by maximizing the Healthy, Hungry, Free Kids Act, new provisions for CACFP in nutrition and wellness. First thing I want to do in terms of discussing this is make sure we're all on the same page and understanding what CACFP is, since we're talking about that today. It is a federal food program. It's an entitlement. It's a program that has a broad reach. There are 3.5 million children served every day in this program. That's a lot of children in childcare throughout the United States. And they are predominantly low income, which makes CACFP an excellent vehicle to address health disparities by improving nutrition in early care and education. There are, in fact, 1.9 billion meals and snacks went out for CACFP last year. That's a lot of meals and snacks. And in fact, they're healthy meals and snacks now. We know from the IOM that they contribute actually to healthy eating, and IOM has recommended expanding the program as a way to address obesity. But we also know from the IOM and other studies that CACFP could be improved. And that's why we worked hard, including Mary, I want to give you credit, on the Healthy, Hunger, Free Kids Act, to make sure that there were important changes made in there. And now we need to work hard to make sure that those changes are actually fully implemented and have the impact that were intended. So let me turn now to those changes. There's two basic changes. The first is that CACFP now has to provide nutrition education, and it has to provide education about increasing physical activity and decreasing screen time. So that's an important and historic change. The second change is that the CACFP nutrition standards are going to be updated. So how are those changes being implemented? Well, basically in three ways. And here's where I'm going, because I don't have PowerPoint slides, I'm going back to the finger method. One, we all remember that, we go back from PowerPoints to overheads back to hand signals. So number one, which was implemented immediately, was to look at the beverages. And so the CACFP providers have to always make water available, and milk, which is served with all the meals, has to be non or low fat. It's interesting to see the important changes, the kind of caloric changes and important cost-effective savings that Bill talked about that could come from a change like that. So that change was implemented immediately and is being smoothed out now. The second thing is the implementation of the nutrition education requirement, which is ongoing. This has there's 2 points here. One is try to improve the practice and the policy around nutrition, physical activity, and screen time in CACFP childcare. And then the other is to prepare providers now for the new standards. So it's an interim measure, so people get ready. And what do we know from school lunch, the changes in school lunch? We know, Hannah, right? We know that we look at those districts and Lorelei and all the people who worked on that, those districts and those schools that were already making changes, they did much better, right? So we don't want family child care providers to be surprised, like, oh my, well, we had no idea this was important that we were going to have to do this. So that's the other thing. So finally, to get to the third thing is that the standards will be changed. And I'm sure that we're going to hear more about that from Undersecretary Kincannon later when he speaks, but it's my understanding that that would be proposed pretty soon, and that the idea is to get those rolling within a few years. And so we have very significant opportunity here, which is my task today, to all work together to maximize those changes, their impact within the child care system. And I think one of the main things that we really need to do is both support all of those changes from all the sectors that we have here on the national, state, and local level, and at the same time work to expand the program, because there is a lot of child care that low-income children are in that does not have CACFP. And we do know that some of that child care is really poor quality. We have low-income children in child care where on many days they're just getting a lot of ramen and crackers and they're parked in front of the TV. And this is something that we all want to make sure doesn't go on anymore. And if we want to address health disparities and we want want to address obesity. I think that improving CACFP, expanding the program, those are the two real opportunities that I see. We want to make sure that this does the very best that it can. One thing that I'll offer as an example, because we were talking about innovative collaboratives, one thing that we've been doing on the state level is working on state summits around this, so bringing together all of the different sectors. So bringing together nutrition and obesity advocates and experts, anti-hunger advocates and experts, the people who work to make sure people can get produce and fresh fruits and vegetables, the industry, the researchers, foundations, and really talking about how people can use these changes in CACFP to reach the shared goals that they have to improve childcare and address health disparities and address obesity within states. And they've been very helpful. They come out with commitments from all parties and recommendations for moving forward. So I really recommend that from the point of view of what we heard earlier, if we want sort of action-related collaboratives, those work pretty well. So I want to conclude by thanking all of you for listening and to say once again that I really think that we need to emphasize the importance of CACFP and expanding it. We need to really focus on the fact that we want to maximize the impact of these healthy, hunger-free kid changes. We want to make sure that they get to more kids, and that I really think that that is a key way within the system of all these changes that we can bring some resources to family child care providers, to child care centers, that we can bring training that they don't have, and we can bring oversight. So I really think it's going to make a big difference, and thank you for listening.